Okay, this is the third attempt. Um, in 8 minutes, it'll be too late to submit this. I hope you give me a break. My phone went out 2 times. This is my computer's camera. So let's begin. Are you 18 or older?
Yes.
Are you? Do you give permission to videotape and to be viewed by a professor, possibly others at Liberty University for educational purposes?
Yes.
Okay, thank you. Okay. Yeah, and there's electronics back there.
Oh.
Okay, so what I'm going to do, I'm going to do an assessment. I'm going to start with your abdomen.
Okay.
I'm observing the skin. There are multiple strawberry angiomas over the skin of the abdomen. The skin is dry. There's sparse hair. There is a scar. I'm going to move your waistband.
Yes.
Okay, and let's see. The scar measures 4 inches. 4 inches of the scar. Vertical. Vertical to the in the right lower quadrant. The umbilicus is half an inch round, approximately a quarter inch deep. Skin is intact, clean. I'm going to listen to your belly. I'm going to move your pants, okay? Okay, right now I'm listening for vowel sounds. Okay. And in the right lower quadrant, they're present and active. Right upper quadrant, present and active. Left upper quadrant, present and active. Left lower quadrant, present and active. Okay, now I'm going to percuss, which means I'm going to put my hand, kind of bang a little bit, okay? Just going to listen for sounds. Take your waistband down, start. Tympani in the right lower quadrant. No. Faith, please. Thank you. Sorry, honey. Okay, my little girl. Okay, so tympani, have a dull tympanic sound, dullness, and that is the upper right quadrant, upper left quadrant. Tympanic, tympani, it's tympani. Okay, so the lower left quadrant is tympani as well. Okay, I'm going to percuss and measure the liver. So I'm going to start at your belly and kind of move up, okay? Starting at the umbilicus, at the medial line, and tympani, dullness right there. Okay, now let's see. Starting at the fifth intercostal space, mid-clavicular line. Oh, I don't want that in my hair. Resonance, dullness. 1 inch, 2 inch, 2.5 inch. 2.5 inch is the liver span. And now I'm going to percuss the spleen. I'm going to start at the 6th intercostal space, just posterior to the mid-axillary line. Notice a little difference in 10. Ah, okay. Let me start over. I think I was a little too posterior. 10, dullness, 11, dullness. Okay, so I was able to percuss the spleen. Okay, now there's let's see. Oh, the leg is up, by the way, due to pain. The subject has pain in the right leg, groin area, due to an injury. Going to now I'm going to do what's called. I said it twice already. I'm just tired. Let's see. Going to palpate your abdomen. Okay, so let me know if you feel any pain or tenderness, uncomfortability. Okay. All right. Okay. I notice a little bit of distension. It feels like in here, right over the small intestine. Okay, I'm going to attempt to feel the liver. Okay.
Yes.
Okay. So, costal border. Okay. Okay. I can feel the liver. Liver is firm. Um, the skin is movable, while the abdomen is movable. I can feel the liver moving. Also, there's no there are no lumps or anything like that. Is there tenderness when I palpate the liver? No. Okay, I'm going to continue now. Okay. Soft, movable. Appears to be some firmness here. Actually, yeah, over here there's some firmness. Soft here. Okay. So in the right lower and upper quadrant, medially, there's some firmness to the abdomen. Okay, there. No pain, you say?
No.
Okay. All right. So let's see. I have inspected. I have percussed or auscultated. I have percussed, and I have palpated the abdomen and liver spleen as well. Okay, so right now what I'm going to do is I'm going to attempt to capture the kidneys.
Okay.
Okay, I'm going to put my hand under your flank.
Yes.
Okay, I'm going to ask you to take a deep breath in. Okay, now go ahead and let it out all the way. And I'm unable to capture that kidney. Oh, I want to palpate your spleen too, so
Yes.
it'd be okay if I do that? All right.
Yes.
Okay. between is it's firm. It's movable. And did you feel any pain? No pain, no tenderness. Okay, now I'm going to attempt to capture this kidney. Hand under the flank. Go ahead and take a deep breath. Let it out. No luck. Okay, well, we'll continue to move on. That is actually the third attempt at capturing a kidney, and I'm still not able to do it on this particular subject. So maybe I can on the cat. All right, let's see. Next is we're gonna move on to musculoskeletal. So if you please have a seat in the chair. We'll start with your head and your neck. Oh, you know what I forgot? Can you lay down again? I'm sorry. I'm very sorry.
No problem.
I have to auscultate your arteries. So we're going to start with the renal artery. I'm listening for a hum or a brewery or a swoosh. A brewery, not brewery. Okay. Abnormal arterial sounds absent at the renal artery. Here, I listened to it. I don't know if you can see that. Let's see. Iliac artery. Now sounds present. No adventitious sounds from the arteries. I'm going to go ahead and listen to your femoral artery. Okay, nothing there. Nothing there. All right. Thank you, sir. No breweries or hums. No breweries or hums out of the arteries. If you'd have a seat in that chair, I will. There we go. Okay. Oh, it's recording. Good. I got nervous for a minute. Okay. Let me wash my hands real quick, if you don't mind. I don't want to go spread stuff on you. I probably should be wearing gloves. Probably have some somewhere.
I tested negative.
Huh?
I tested negative.
Good. For everything.
Yeah.
Well, good. All right, sir.
Upon retirement.
On retirement.
Yeah, I got the full battery.
Yeah. Yeah. I got a needle stick once.
Once too many.
Yes, it is. Well, I'll never forget that. It was a terrible moment. Okay, so let's see. Hi, Faith. We're doing something. I'll let you know when it's over. I'm sorry, Faith. All right. What was I doing? Oh, that's right. Okay, so we're gonna test your range of motion. Would you sit in a neutral position, please? Okay. Let's see. Go ahead and we're gonna test the range of motion on your neck. Would you lean your head forward like this? Great. Back. Okay. So back to neutral. Okay. So forward was extension. Back was hyperextension. Please try to touch, without moving your shoulders, try to touch your ear to each shoulder. Okay. It looks like there's some limited range of motion from side to side with the neck. Now, this is called rotation. Go ahead and move your neck like that, all the way. Good. Okay, so when the subject turns his head to the right side, there is some limitation to the range of motion. Now we're going to check strength, okay? I'm going to put my hands on your cheeks. When I do, just turn your head against it. We're checking the sternocleidomastoid muscle. Go ahead and turn against it. Good. And the strength is good. Strength is good. Okay, now I'm going to put my hand on your forehead. Please move against my resistance. Good. Backward. Good. Strength is good. Okay, so we've checked the strength and the range of motion of the neck. Now I'm going to palpate. I'm continuously observing the subject. I want to, and I'm doing that probably without saying, but I am observing. Okay, so I noticed there's some hard tissue in the neck, in the spinal, in the dorsal region of the cervical area. Oh, cat, no, cat. That's an expensive laptop. Okay. This hardness in tissue, I suspect is it feels as if it's scar tissue. Now I'm looking at the shoulders. I notice that the right acromion process is pronounced. It is slightly, actually the left shoulder appears to be thickened. It's warm compared to the other one, and there appears to be some edema at that location in the left between the sternocleidomastoid and the trapezius. Okay, so all right, moving on. Okay, observing the shoulders from the front, I do see enlargement of the left shoulder. I noticed that the acromion process is slightly elevated compared to the other side. And the clavicles, the right clavicle, right shoulder swelling, right shoulder elevated acromion process, right shoulder exaggerated clavicle angle, and left shoulder. I'm sorry, it's been a long day, and this is try number 3. Right shoulder. The right shoulder appears to be normal. We're going to check. So let's see. All right, would you please stand, sir? Thank you. Okay. So at this point, I'm going to ask you to raise your arms up and touch hands if possible without bending your elbows. No. Okay. So that is, and then bring it back down to your side and cross midline. Okay. So when they went up, that was abduction. Adduction to the medially, when he brought them down immediately. Okay, thanks, sir. Now, if you would, let's see, if you would, let's see, man, I knew it last time. Let's see, I believe it's flex. Please flex. Bring your arms up. Good. And now bring them back down and past your midline extension. Good. Flexion, extension. Range of motion is good on the shoulders. So is, well, the abduction was somewhat limited. Adduction was within normal limits. Appears to have full range of motion at that point. Let's see. Okay, so now I'm going to ask you to internally rotate your shoulders. I'm going to come around behind you. Okay. And please bring your hands down and clasp your hands behind your back down lower, and then raise that clasped hand. Well, actually, Yeah, like that. That's external rotation of the shoulders. Okay, thank you. Thank you, sir. So that range of motion is complete on your shoulders. Now, I'm going to ask you to touch your shoulders with, okay, elbow range of motion, now all the way down. Good. Now hold your hands out like this, and then is pronate, supination. Okay. Now back to pronation. If you would, let's see, if you would move your hands like that, that is ulnar deviation in like this. Keep your arms straight, please. Thank you. And that is radial deviation. That's fine. Thank you. And let's see. All right. Now hold your arms out. Go ahead and go against my resistance. Good. Okay. That's fine. Now that was deltoid strength, and the strength is he's strong in his deltoids. Let's see. Maybe we should do the full delts. Okay. So hold your hands out like this, up against me. Good. And then pull your arms straight down. Good. Good. Okay. So now, so we just checked the all the sides of the deltoids. I don't know if that was necessary, but we did that. Okay. So now, hold your arms out like this. I'll go against my resistance. Good. Go against my resistance. Good. Okay. So when we're coming up, that was bicep strength. Down was tricep strength. Now, if you would hold your hands out and point them upward. Okay. Now downward. Good. I'll hold them straight out again. Okay. Now move your knuckles, or move your fingers straight down and straight up. Good. Now go wide and go like this. Okay. Now please touch your fingers to your thumb to each finger, and then your thumb to the base of your pinky. Good. Thank you, sir. Okay, so we just checked the range of motion of the wrists. The range of motion is full. The range of motion of the fingers, range of motion full, and the opposition of the thumb is intact and full. Okay, now I'm going to check the strength of that area. Now, if you would, let's see if I can remember. Okay, so please lift your hands like this against my, good, okay, and down, good, okay. Now with your fingers, just your fingers against, good, okay. Yeah, go ahead and grip, good, good. Okay, now I'm going to hold your hands like this. I'm going to try to keep them closed, open them. Good, the strength is good in the fingers. Now I'm going to keep them open. Go ahead and close that one. Okay, good. Next. Good. Okay, wonderful. So the strength in the hand is good. They're strong hands. Let's see what's next here. Oh, please grip my fingers as hard as you can. Wonderful. The grip strength is strong. And so we have gone through that. Now we are to the hips. Actually, while you're there, would you please sit? And what we'll do is we're going to go a little bit out of order. Simply because of the leg pain that I mentioned before. I want to try to minimize the movement of the patient up and down. It's going to aggravate the pain. And he's been up quite a while, and with this being the third assessment, I don't know if you can notice his face, but he's a little tired. So he's been gracious enough to let me continue. That's right. Okay, so what I'm going to ask you to do is hold your legs out a little bit. Actually, let's see. Okay, so go ahead and bring your toes to your face. Good. Straight down. Okay, so that's okay. Let it loose. This, when he brought it forward, was dorsiflexion. Down was plantar flexion. Do this one too. Okay, dorsiflexion, plantar flexion, full range of motion. There was a pop when he did his plantar flexion. Not unusual for a man of 25 years old, 25 years of age?
Next week I'll
Next
turn
week.
25.
A man
Yes.
of 25. Okay, next, if you would take this ankle and please rotate it as I'm doing my, yeah, there you are. Thank you. Rotation, rotation, full range of motion, rotation again. Okay, other way. There you go. Rotation, full range of motion, rotation of the ankles. Let's see. Okay, so now, please, with just your ankles, do the plantar flexion again. Good. Strength is strong, and do dorsiflexion. Good. Strong strength. Okay, so we've assessed that. Let's see. Oh, I do want to palpate your joints. Okay, that's something I did in the first two to a degree, and I'm doing it again. I do feel some warmth in the left shoulder. Okay. I don't feel any growths. There are no lumps or masses in any of the joints of the upper extremities. Let me just go ahead and take a look at the knees. Okay. Feel any pain when I'm doing any of this? No? Okay. All right. Okay. All right. So the joints appear to be intact. No masses. No growths. Would you please lay down again on the floor, sir? Thank you. I appreciate it. Okay, we're moving on to the hip. All right, here, let's do that so that they can see. All right, so now if you would extend your legs, please. Here, you need help. All right. There. Okay, so with your right leg, are you able to lift it without bending the knee? That indicates lack of strength. I'm going to help you. Tell me when it's far enough.
Okay.
Okay?
That's good.
Okay, range of motion limited upon flexion of the hip. Now I'm going to bend your knee. Range of motion somewhat limited upon flexion of the knee. Flexion of the hip, continued flexion of the hip. Now we're going to abduct. Tell me when.
Right there.
Okay. Now we're going to adduct.
That's good.
Okay. Thank you. Now I'm going to bend your knee again, and I'm going to do external rotation of the hip.
There.
And internal rotation of the hip.
There.
Okay. All right, would you do the same with the other leg now? Straight up, bend the knee. Okay. Limited range of motion upon flexion. Okay, now straight up, and then outward, and inward. Okay. All right. Good. Good. Okay. So with the left leg, full range of motion. With the hip so far, we haven't done rotation yet, but or hyperextension. But with the right leg, right hip, there's limited range of motion on adduction and internal rotation, external rotation, full range of motion, abduction, full range of motion. Next, would you put your foot next to your knee, please? Okay. Now bring out. There you go. That's external rotation and internal rotation. Okay. So that's good. There's a limitation on both. Not very pronounced, but there is a slight limitation on both. I really don't know how to grade that. I'm sorry. Okay. All right. Here we're going to do a strength test on this leg first, if it's okay, unless you need a break. Okay. Go ahead and lift your leg against my hand. Can you lift it?
No.
There's some movement, not much. Very weak. The right leg. Okay, this one. Good. That's strong strong resistance. Okay. I'll lift this one a little bit and against my good. The other one, we're gonna do it again. Good. Okay. So then the extension strength on both legs, both hips is good, is strong. All right. Let's see what's next. Okay. Would you please stand up, sir? Do you need help? You have it. Okay. So let's move this so that we don't have to step off of the blanket, please. All right, so now what we want to do, okay, go ahead and stand this way. All right, I'm going to give you balance. We'll do the other balance. We'll do the balance test later, but I know he needs help with this balance. Go ahead and move this leg back. Straight back if you can. Yeah, good. That's hyperextension. Next one. Hyperextension is, so with the right hip, the hyperextension is limited. The left hip, the hyperextension, full range of motion. Okay. All right. So now we're good. Okay. So if you would please position yourself this away. Please stay there. I'm going to change this. Now I'm going to have you touch your toes. Please touch your toes, sir. Good. And then come back up. Okay. Okay. There is an abnormal curvature to the spine, and the cervical region appears to be exaggerated, more of an S shape. Okay. And now. Oh, that's right. These tests. Okay. Would you turn around, please?
Yes.
All right. Now, if you would, here, step back to here. Let me help you. All right. Now what we're going to do is a heel-to-toe walk. Like you see on the, go ahead and put your hands out if you need to. Good. Okay. Thank you. Balance is fairly good. I'm going to ask you to put your feet together. Close your eyes. I'm going to push you back, okay? This is a Romberg sign, and this is the Romberg sign. Now it's got good balance there. Okay, let's see. Now let's move to reflexes. Okay, we'll start with you standing. I'm going to start with your upper body here. So I'm going to do the bicep. Now I don't have a hammer, so I'm improvising, using my finger as a hammer, actually. Okay, I was able to observe some contraction of the bicep, I believe. Right. Some contraction of the bicep. Okay, now we're going to do the tricep. Okay, I noticed some contraction of the tricep with that. Now I'm doing the brachioradialis, and that was a clear response. I'm going to go do the same thing with this. Let me do your bicep again. I'm going to make sure I'm doing this right. Okay, I felt that time, and I saw. Hey, please, come on, honey. Go back to your bed. I know you're having fun. Okay, some contraction of the bicep with bicep reflexes. I'm going to do the same. Tried this earlier and it worked a lot better than this. Broke it this time, Dad. Okay, there was some slight contraction of the tricep Oh, left side, now the brachioradialis. Okay, there's some response there. Okay, so that was successful. Now, if you'll have a seat, please. I will check your knee. Thank you for propping that up. Do you need me to prop it up, or do you have it?
I got it.
Okay. Okay, that's good. Next one. I noticed the movement. Oh, yeah, they can see. Okay. Oh, nice. That's hypertonic. That one. Man. All right.
Ready to run.
Okay, now I'm going to do the Achilles tendon here. I think it's got to just be hanging, but let me try. I feel not so much on your right leg, but on your left leg, I do feel some response to
Nerve damage.
Yeah. Okay. Yeah, not so much here though. I really feel very little on your right leg. Your left leg, her left Achilles tendon, I can feel a response. Okay, so there are your reflexes. Oh, another one. No, joking. All right. Okay, so next we're going to move on to the. Oh man, what's the name of that one? Oh, I'm not supposed to show you what I'm putting in your hand, so now I'm going to have to find something else. Don't look.
I'm not looking.
All right. I have an object I'm going to put in your hand.
Close my eyes.
Close your eyes. Okay. Then tell me, what do you feel in your hand? Okay, nice. All right. So the subject was able to identify a pen through stereogenesis. Close your eyes. I'm going to write a number.
8.
8. Okay, let's do the other.
8.
Okay, I'm going to put an object in your other hand. Close your hand. What is that?
Quarter.
Good. Okay. Stereogenesis and graphethesia. Graphethesia to identify the object. Okay. We're going to. Okay, so I'm going to do something. Close your eyes, please. I'm going to touch you with 2 points, and then I'm going to lessen the distance. Tell me when it becomes 1 point. Okay. What's that? How many?
I can't tell.
What does it feel
Feels
like?
like 1.
Feels like 1? Okay, it's pretty wide. I concocted that.
I also have nerve damage down this arm, so.
Okay.
Right.
Okay.
Splits that aren't too good.
Okay. Try the other one here. That one?
It's hard to tell.
Okay. All right. Now, here, let's see these legs. How many? 1 or 2?
I barely feel it there.
Really?
Yeah.
Okay. All right. So obviously there's limited 2-point sensation. Let's see. What's next? Sharp and soft. So here, you're gonna just take a look at these. You can see them. Okay. This is sharp. Do you feel that?
Yes.
Okay. That's dull.
Yes.
Feel that? Okay. All right. So close your eyes. What's that?
Dull.
That.
Dull.
Okay.
Sharp.
Okay.
Sharp. Dull. Sharp. Sharp.
Okay.
Dull. Sharp. Dull. Sharp.
Okay. All right, great. That's that. Let me think if I can think of anything that I missed. Yes. Would you please stand?
Yes.
I'm going to palpate your spinal column. Don't mind. Okay, in this area I feel, feels like a lot of scar tissue, and there are scars present. I lose the ability to palpate the That's okay. Differentiation in the vertebrae from this point, which is at right where the lumbar begins. Yeah. So where the lumbar begins, I lose the ability to palpate the distinct vertebrae. Feel any pain when I do that, sir?
No.
No. Okay. All right. Okay. Well, I believe that's it. Thank you.
Thank you. Bye, Joe.
Thank you. Yeah.
I think he's got it.